Thank you very much for inviting me to come for this very big meeting where I'm going to reflect what's going on in Arctic. As you see here, my name is Bahiru Bazardi of the Georges. I'm orthopedic surgeon by profession, assistant professor, head department of orthopedics, Black Line Hospital. That is the tertiary level, the only referral hospital in the country. I will show something for your memory. A lot of you knows about Ethiopia. This is a land of 13 months of shine. As you know, some 17 years back we become landlocked. We are one of the African countries with a locked land. And then when you see we are the third largest population in Africa, population over 80 million. The population density is about 57 square meters. In lowlands, it becomes 19 square kilometers in lowland. Our medical service utilization is 0.3. Life expectancy is 48 years. We are a very big number, 44% is less than 15 years, and above 65 years are very small comparing to you. And the number of orthopedic surgeons is about 50 working in the public and private sector. And then since very recent we are recording double-digit economic growth. We are constructing the largest hydroelectric dam, which is Renaissance Dam. That's going to be the first in Africa. On the list of nations, excellency in African football. The country is moving forward to achieve the maximum through growth and transformation plan. We are a cradle of mankind. This is Lucy. It's where the humankind originated. These are our ancient civilization. That is Fasil Castle in Gondar. This is Aksum, as you know it. And then it's the mother of warriors of independence. These are our warriors some years back. And they used to be known for drought some years back, political violence, and then a long distance runner. She is number 50 in the world record. Turunesh Dibaba, maybe you know her. When we come to orthopedic service in Ethiopia, it's the modern orthopedic surgery is believed to have been introduced by expatriate surgeons, mainly in the early 19th century. And surgical units and departments were made to be a major component in the hospital that were established thereafter. Early 20th century, Ethiopians were sent abroad for higher learning, some of whom went on to study. Except Italy, we sent some people to learn their postgraduate training, and hopefully we're going to start now. It is a good green sign that we will see. To address the orthopedic needs of the population, the Black Line Orthopedic Department was established in 1987 by the help of British World Orthopedic Concern. And then we have graduated with extensive training, especially in trauma, infection, and the modest other orthopedic clinical training to tackle the orthopedic care in Ethiopia. This is the main Addis Ababa University Medical Faculty Black Line Hospital. I think some of you know it. This is a newly built Black Line Rehabilitation Center. We are here where there is a prosthesis, orthesis, physiotherapy, and orthopedic surgery. And then here we have a very latest modern 4-operation theater which can accommodate, and then it's built by Australian Doctors for Africa. They donated about 10 million birr. That is about 500 Australian dollar. And then recently we opened, I think a month back. I think you Italian orthopedic surgeons are going to enjoy with that. We approximately 50 orthopedic surgeons practicing in the country. From this, 80% of this in the capital city. No official subspecialty we don't have. When we come to orthopedic training, which is we stand for it, we're going to see the access, the general organization, activities, control of training, and then control of training center. When we see it, who comes to study orthopedic surgery? It's somebody who has to have a medical degree, and then we prepare a national examination, 100 MCQ, 5 essay questions, and then we interview them. And then the ranking according to the examination, qualification in medical school. We elect by ranking of medical specialty, teaching institution, and administration region. It's very important. When you see in our country different administration regions, some of them are more growth, the others are not. For that we have to share that by taking, for example, Somalia, Afar, Gambela, and these other regions. If we see Tigray, Amara, Oromia, and South regions, they are better than those we have mentioned. If we see the general organization, it's a 4-year training, and now recently we are taking 20 residents per year. Few females, we don't have a lot of male, we have a lot of male, but females they are not happy to come to the orthopedic surgeon, but now we are encouraging, and then they are coming. At this time, we have about 5 female orthopedic surgeons in a different training program, and then one is already the consultant. Some years before me, she was the head department of orthopedics, and then people are coming to us. In our recruitment, some years back, the orthopedic surgery was not very well known, and then annually we are getting 1 or 2 residents to come to us, but at this time the number is increasing, and they are very talented, young, energetic people who want to be orthopedic surgeon, as they are exposed to the world orthopedic relation, and that's why when we see the rotation activities, externally compulsory anesthesia, plastic surgery, radiology, and general surgery, we do send to do their external rotation. When you see surgery, it's a progressive responsibility. They can be second assistant, first assistant, or supervised surgeon. We have 7 hours per session, 1 to 4 sessions weekly, and no compulsory number and then type of surgeries. They can do what they get it on the operation theater. When you see the duties, a period of 24 hours on duty, from 2 to 4 days per month has to be heavy work in emergency department, light work in the hospital ward. Most hospitals, they don't have, if we send our residents, they become a first call. The other thing is, in a Black Line hospital, daily, a minimum, an average of 12 emergency trauma patients we see. From these, 80% of them need to be operated for surgery. But only we are taking maybe 20%. We have a lack of instruments, lack of bed, and then all these things. For that, we are here. It's a deadly need of your support. We to grow up and then to help these poor, sick people. When you see the outpatient, our residents, they go to assisted or as an assistant in practical or regular, no compulsory. Many hospitals, they don't have orthopedic outpatient department. The general surgeons are who are dealing with them. When we see in inpatient, it's a variable organization according to the department clinic, and they do some bureaucratic tasks. Main medical worker for hospitalization ward. Theoretical teaching, we have weekly session always Thursday, session for 50 minutes to 2 hours, irregular, great variability, type of surgeon we discuss with emergency case, surgical case, hospitalization ward, bibliography, monography, radiological or histological discussion we do each week. The whole day we dedicate to the theoretical training. The control of training, the head of teaching, that's me, head of department, the tutor, logbooks, and then continued evaluation, annual evaluation, logbook, and the staff opinion. Compulsory examination. First year, when they finish, we do examine, no intermediate examination, and then we do the final examination. If they are not approved in the final, and then they are disqualified, or they have to repeat it. Control of training center, mainly the Ministry of Education, with collaboration with Addis Ababa University, periodic audit, control of logbook, the AC bed, facilities, surgical activity, and outpatient activity, and some libraries. And then what we see, the public awareness regarding health services in general and orthopedic service in particular is continuously increasing at the level. Before our patients, they were going to the local healers, and now they are coming to see by orthopedic surgeon or somebody who is still there is a great gap which is going to be filled by you and remain between service provision and demand from the population at large. And effort to address this challenge, we started to, our intake become almost, I think, 300 times increase in 2013. The intake of our candidate orthopedic surgery. It is a big, now this year we recruited about 26 people. From these 26, there are some 4 experts from Somalia, South Sudan, and I think it's one from Djibouti. And then for that, our department is getting increasing, but we need to sustain your help. That is one of the things which we are here. Need of subspecialty program. That is, as you know, in our country, recently in 17 years, the medical, before there was only 2 medical universities who are teaching medicine, but now the number is increased up to 30. For that, we, Addis Ababa University Black Lion Hospital, and then we want to strengthen our peripheral teaching institution to reinforce training of orthopedic, general orthopedic surgery, and then we want to do subspecialty. That is our goal, and then we plan for that. I think this is the most important thing. Need of the country. High demand in trained manpower, both in general orthopedics and graduate in subspecialty, to improve both quality of care and training. The need to maintain rigorous standard in a surgical practice is what the profession demands, achievable through collaboration with the Italian Orthopedic Society. And then this is a big opportunity for us. I think I have to talk with all orthopedic departments, universities, as you expose me to talk with them, how we can cope and network. You are welcome in Addis. Accepting change is one of the things, implementing new technology in medicine. Let me show briefly what's going on in the Department of Orthopedics in Black Lion. We are now 23 staff, 12 consultants already there.